Oklahoma's mental health system is under the microscope, and the findings are raising eyebrows across the country. All right, let's break this down. The Department of Justice recently launched a major investigation into how Oklahoma treats people with mental health and substance abuse issues. And what they found, well, it's not great. Turns out Oklahoma's system is unnecessarily committing adults with these conditions to psychiatric hospitals, which is a huge violation of the Americans with Disability Act. Here's where it gets even more concerning. The Oklahoma City police are frequently called in to respond to mental health crises, even when there's no public safety threat. In many cases, instead of sending a professional mental health worker, the police get involved. And this can escalate situations that don't need to be escalated. Imagine being in a mental health crisis and having a police officer show up when all you need is someone trained to handle the situation. It's no wonder things sometimes spiral out of control. The DOJ investigation has been looking at how these emergency responses often don't match the needs of people with behavioral health disabilities or their families. Instead of providing care, the response can often make things worse, pushing individuals into psychiatric hospitals or arresting them when they may not need to be there in the first place. Assistant Attorney General Christian Clark has called out how these situations aren't just mishandled, they are needlessly intensified by the lack of appropriate care and the use of law enforcement in scenarios that should be dealt with differently. So, what's being done about it? Well, the DOJ has stepped in with a plan. They've started working with Oklahoma and Oklahoma City officials to reform the system here and make sure people are getting the right care that they need, rather than being locked away or treated like criminals. But here's the catch. If the state doesn't get its act together and make changes, the Department of Justice isn't afraid to take legal action to force them to comply with the law. Now, these reforms are a big deal. The people being affected by this, adults with mental health and substance abuse issues, are not getting the care that they need in our system. And with these changes, Oklahoma could be on the track to improve the system so that mental health professionals handle these crises instead of police officers, ensuring a better quality of life for people with disabilities and their families, and also to make sure that the communities are kept safe.